Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. And you can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, so you can make use of it. Okay. Now you know that we are discussing about fever, approach of fever in children. Already we have completed almost 11 parts. Now today the 12th part. So first question is onset of the fever. Second question is response to the antipyretic drug. And third question that you have to ask, what about the interfebrile period? Now this is a very important thing. What about the interfebrile period? So in Ayurveda, if you are talking about Jora Vega, what about the Jora Vega? Okay. So in terms of Ayurveda, we can correlate with this interfebrile period with the Jora Vegas. Now, in case of viral fever, fever will be high, as I told earlier, but interfebrile period is normal. So, what do you mean by this interfebrile period? Suppose the gap which is occurring between two episodes of the fever. That means, suppose child start with the fever at 6 p.m., 6 a.m., and you have given the antipyretic, and by 8 p.m. the 8 a.m. within 2 hours the fever reduced. By 8 a.m. child was fever free, and from 8 a.m. to 10 a.m. child was fever free, and 10 a.m. again child start with the fever. So between 8 a.m. to 10 a.m. that 2 hours, so that is called as interfebrile period. That means the period between two febrile episodes. Okay, now we have to ask, what about the interfebrile period? What is the nature of the child, character of the child, behavior of the child during the interfebrile period? If during this interfebrile period, when the child is fever free, during that time, if the child is playful, child is normally playing, jumping and playing everything, so usually in normal interfebrile period or a happy interfebrile period is indicative of viral fevers. Okay, indicative of a viral fever. In case of viral fever, fever will be high, but the interfebrile period is normal or happy. Whereas in case of bacterial fever, if you are talking, interfebrile period is never normal. You look at the patient of typhoid fever, although there is no fever, they are confined to the bed. They are very dull. They are very toxic looking. Okay, so in case of bacterial fever, the interfebrile period is not normal, it is sick looking. Okay, it is sick looking. Very important differential diagnosis for the differentiation between the viral fever and as well as a bacterial fever. So child will be dull and sick looking, and although there is no fever, you have given the antipyretic, fever is reduced to some extent, but still child is not active. Child is very dull, sick looking, irritative. Whereas in case of viral fever, the interfebrile period is quite happy and normal. Now, for example, as I told, look at the fever of typhoid. It's a bacterial fever, isn't it? So, although the fever comes down, child is lethargic, toxic looking, and not playful. What is the reason for this? So, the reason is very simple. See, virus, they only produce the chemicals. Chemicals, they will act, and when tissue damage will be there, its effect will be there. Then there is a fever. The fever comes down, finish. Whereas bacteria, they do not produce the chemicals, they produce the toxins. So when the toxins are released, the effect of the toxin will be there for a longer period. Therefore, although fever comes down, during the interfebrile period also child is dull. This is a very important factor. Okay. Now child sick looking in the interfebrile period likely to be bacterial. Likely to be bacterial. Now when I say sick looking, what is the meaning of sick looking? Sick looking means child is not active, child is lethargic. Okay, there is some change in the behavior. Deha manasantapa lakshana. Deha santapa is assessed by the temperature. Manasantapa, it is sick looking. Okay, so child is change in the behavior of the child. Child is irritative, child is more crying, child is not active, child is not playful. Okay, so this suggests the sick looking child nature. Okay, so why this is happening? Because bacteria always produce the toxins. They never produce the chemicals. Chemicals are released or outbursted by the viruses. Okay, So this is very important question. What about the interfebrile period? So by the help of the interfebrile period, now we have differentiated virus and as well as bacterial fever. But we have got two other important disorder. One is parasitic fever and another one is a immunological fever. Okay. Now, what happens in parasitic fever and immunological fever, that we will see in the next class. Thank you very much.